Effects of anxiety and how to conquer it. Introduction. Anxiety, or simply nervousness, is a state that affects both the mind and the body. During this state, the victim shows many worries and experiences several panic attacks. Medical specialists define it as disarray that interferes with both the physiology and the psychology of a person. The victim of anxiety stands out well, even if in a crowd, following the evident emotions of trepidation, uneasiness, as well as dismay. Worth noting is that anxiety does not just happen for no reason. It is normally a way that the body employs in responding to stress. However, one can ask, is anxiety a bad experience? The question arises following the many cases of anxiety depicted by virtually all people. In response to the question, anxiety is both good and bad. It is good because it can help the body cope with some tough situations. However, this claim is only valid if the anxiety lies within some limits. If it goes beyond the expected limits, it is no longer helpful but harmful to the body. In addition, how the victim reacts when anxious tells whether it is bad or good. Worth noting is that anxiety, in general, affects the victim, with some of them claiming of being seriously ill. For instance, anxiety causes depersonalization as well as derealization. Effects of anxiety. Although the two may seem the same in meaning, depersonalization and derealization are significantly different. While the former refers to the separation of one from his/her body, the latter refers to the disconnection between one and his/her environment. They result from excess anxiety. Any depersonalized anxiety victims experience a state of being detached from their bodies, the result of which is a lack of passion for oneself. This condition is short-lived. However, derealized anxiety sufferers feel as if they are in their world, thinking only about themselves in terms of their mindset and experiences. They suffer this psychological isolation for some weeks and then the condition heals. Excess anxiety too causes irregular heartbeats. The aforementioned effect, better known as panic and palpitation, results from the fact that anxiety is increasing. It grows from mild to intense, inducing a lot of fear to the victim. However, the fear responsible for bringing panic is not the fear of an object, nor is it the fear of a person or place. It is the fear of the psychological and the physiological signs of anxiety. An anxious person experiences a state of first fear that comes following the victim's endeavor to respond towards minor shocks. A gradual rise in his/her heartbeat follows, followed by fear of what might happen next. On the issue of palpitation, the victim of anxiety imagines the possibility of his/her heart failing to function well. In fact, according to them, the heart can either burst or stop functioning at all. This condition only calms when the levels of anxiety go down. Anxiety too causes difficulties in breathing, swallowing, and muscular weaknesses. However, specialists have come up in handy to address the remedies of anxiety. Knowledge of thought management and perceiving things positively are working remedies for anxiety. How to conquer anxiety. There exist several methods of conquering anxiety, and among them is learning how to manage one's thoughts. Hamric asserts that a natural and permanent cure for anxiety panic attacks is a method that teaches you how to master your thoughts and reduce the levels of your anxiety. This, however, explains the reason behind the many organizations as well as publications put in place to purely address the issues of anxiety, for instance, the American Medical Association and the Emergency Medical Services. Research has it that anxiety comes from the mind when the individual interprets or imagines negative outcomes. For instance, Guyatt claims, "You are the only one that can control it," when the mind perceives relatively harmless situations. Therefore, one has to set his/her mind in a way that does not allow negative interpretations or expectations of situations. In addition, anxiety victims tend to experience moments of difficulty in breathing. Brown asserts that if the victim is not breathing, rescue breathing should be initiated. This, on the other hand, drives home the point that being in an airy place all the time can help conquer anxiety. For paramedics, the subject of anxiety disorders plays a crucial role in their career. Relevance of anxiety disorders. On checking the aforementioned methods of fighting anxiety, creating awareness stands out as the major anxiety conqueror and not medication, as people might expect. Paramedics, who assist professional doctors, have been employed in various organizations to help advance their careers by teaching people about the effects, varieties as well and remedies of anxiety disorders. For instance, according to the Institute of Mental Health, the Anxiety Disorder of American Association, ADAA, is the only U.S. nonprofit organization solely dedicated to increasing awareness and improving the diagnosis, treatment, and cure of anxiety disorders in children and adults. This organization offers the paramedics a chance to advance their careers through the role they play of creating anxiety awareness, hence making anxiety disorders relevant to their careers.